Good morning, my name is Joelle and I work at the Swedish Cancer Institute. I'm a certified tobacco treatment specialist and I work as a nurse practitioner in our tobacco-related diseases and lung cancer screening program. Every day I help people quit smoking, and this video is intended to help you learn how you can quit smoking successfully and confidently. Before we get started, I just want to mention a couple of disclosures. One is that I mention a lot of products in this video, and I want you to know that I do not have any financial interest in these products that are described in the lecture, and I am not a representative of any of the companies who manufacture the products that are discussed in this lecture. So let's talk about relapse. Relapse is not uncommon, and I want to define it first. So there's something called a lapse, and a lapse is when you have a cigarette or a few cigarettes, but you get back into your quit attempt or back into abstaining from cigarettes. A relapse is when you start smoking regularly and you basically resume your prior utilization of cigarettes for longer than 7 days. We talked a little bit about this before, but having very realistic expectations when you're quitting smoking can be very helpful and help prevent lapse or relapse. I've listed a few symptoms that are common in the early phases of quitting smoking, including nicotine craving, which usually lasts less than 2 weeks, increased appetite that can last longer than 10 weeks, depression. So remember, when you're transitioning off the cigarettes and there's alterations in the dopamine levels, you're going to experience some mood changes. And so many of these that I've listed here have to do with the drop in the nicotine level, especially going from smoking cigarettes and that quick delivery of nicotine and that high concentration to going to a nicotine replacement therapy that's not going to give you quite the pow. I find in my patients that the first 2 to 3 weeks is the toughest. That's when people are transitioning off the cigarettes to the nicotine replacement. They're adjusting their lifestyles, creating new habits that doesn't incorporate cigarettes, and there can be a bit of moodiness and edginess. There can be sleep disruption, bowel disruption, and I just encourage people to really know and expect this, but plan for it. Eat healthy, hydrate well, get out and exercise. Think about what you can do to improve your overall well-being and switch up your life just a little bit when you're moving through this quit attempt. There's definitely, we've spent the whole time together reviewing the effects, the physical impact that nicotine has on our bodies and what it means to come off of that nicotine via cigarettes. There is definitely a physiological component to smoking and that nicotine dependence, but there's also a behavioral component. For many people, they've been smoking for decades. Cigarettes just tuck into many different nooks and crannies of their lives, and it can take time to really get out of those routines and habits. Now, identifying your triggers is very important when you're going to make a quit attempt and move through that successfully. Identifying your triggers really helps you understand when you should not have a cigarette, but you need to identify them like road signs. I think of triggers like road signs. If I came up to a stop sign and there was a stop sign in front of me, chances are I would slow down, hopefully come to a complete stop, look through the intersection before I advance through so that I don't get into trouble. Very similarly, when you come across a trigger, think about it like a road sign. Stop, think through it, make a plan, move through the intersection. And maybe part of that plan is going to the kitchen and having a tall glass of water, heading outdoors for a little walk without a cigarette, getting some nicotine replacement therapy in your mouth so that you can get rid of that urge quickly. How to cope with a relapse. Assess what is not working. Think about what just happened. Why did that happen? What was the trigger? What was the situation you got into that made you have a cigarette? It's helpful to get rid of all the cigarettes so that you are reaching for your nicotine replacement therapy versus a cigarette. Identify why the lapse occurred. Do what has worked in the past. So most people know, sometimes people just kind of fall off the horse and they kind of get lax in using their nicotine replacement therapy or avoiding triggers or avoiding circumstances, social situations where they may end up having a cigarette. So think through what has worked and re-engage that plan. Also may want to consider adding something to the regimen, and maybe that means that you've been using the nicotine replacement therapy, but you need to go from an as-needed use of the short-acting nicotine replacement therapy to using it routinely for a while just to get into a rhythm and deliver that nicotine on a routine basis. For some people, it means adding something like Wellbutrin to the regimen to just give them a little extra oomph to avoid relapse. And just get back on the horse. I really like this slide. Don't let a relapse get the best of you. Giving up on a goal because of a setback is like slashing your other 3 tires because you got a flat. Don't get discouraged. Smokers are tough on themselves, and it's very easy to get discouraged when they have a lapse or a relapse. Just making a plan, getting back on the horse, and putting it behind you is the best approach. Next steps, determine what treatment is right for you. We've talked about all the treatment options. I will say that there are some other modalities of treatment out there. People ask me all the time about hypnosis, about acupuncture, massage, aromatherapy, behavioral therapy. Unfortunately, none of these have really been studied at length in the smoking population to understand what is helpful and what isn't, but it never hurts. And if you value some of those interventions, I would encourage you to include them in your regimen, if nothing else, for symptom relief. Get the supplies you need to make this quit attempt. See your healthcare provider if you need a prescription. Tell your friends and family about your plan to quit. Make that commitment publicly so that people understand what you're going through. It's helpful to even say, you know what, I might have some moody days. Just please hang in there with me. I don't expect it to last for more than 2, 3, 4 weeks. But I want you to know that I'm treating my nicotine dependence, and I expect to get through this. Tell people what you're doing. Choose your quit date and initiate your treatment plan. So the most effective way to quit smoking is to engage with counseling, use of nicotine replacement therapy, and a pharmacologic agent. Identify and avoid your triggers. When you have a craving, redirect your activity for 3 minutes. Studies have demonstrated when you do that, that even if you don't use the nicotine replacement therapy for that breakthrough urge, your urge to have a cigarette will go away. Know that the first 7 to 10 days are the hardest, and remember, it's never too late to quit smoking. To learn more about quitting smoking, you can visit our website at www.swedish.org/quitsmoking. Thank you very much and good luck.